I started having flu, so my dad took me to the doctor and I got an injection for flu, but it didn't go away. I didn't cough, I didn't have anything, it's just that I was always tired, so I thought I had flu. So I went to the doctor and that didn't help. I then went to the clinic whereby they diagnosed me with pneumonia. So they gave me medication for a certain period of time. And if that medication didn't help, if there was no improvement, so I had to go back to the clinic. And then I went back to the clinic, they gave me more medication. On another day, I was on my way to school, so I fainted on the way. So luckily I was still in the street walking to take a taxi. My sister took me to another clinic, and then when I got there I couldn't breathe, so they rushed me to hospital. They told me they were going to discharge me the following day, and then when I got discharged, that's when the nurses told me that I was diagnosed with TB, so I'm going to take treatment for 6 months, and then they gave me medication for like a month supply, and then I had to go back to the clinic the following month for more tablets. When I went to get my second dosage of the monthly supply of pills, they told me at the other clinic now near Parklands that they gave me the wrong medication, and the results on their system was that I had MDR TB, not the TB that is treated for 6 months. So they gave me the wrong treatment.
We have so much TB in South Africa that really it should be the first thing that healthcare workers do, is that they ask questions about TB symptoms. But unfortunately, it's not really done. And so if we did that more effectively, then we would diagnose more TB, and then we would diagnose more drug-resistant TB. So I think that's one of the major challenges, is just reaching all of the patients individuals who have TB in the community that are not diagnosed at all or diagnosed way too late.
During the first days, I couldn't swallow my pills, or I had to swallow them. I used to swallow them, and then they would go down, but then they would eventually come back up. So I had to rush back to the hospital, to the clinic again, because when it's still early days, then you have to take your medication at the clinic. So every day you get your pills at the clinic. So now if they come out, then I need to go back for my dosage again.
When we first started in Khayelitsha, the treatment options were very poor. We used these really old drugs, and we used a lot of them, and they were often very toxic for individuals. And they had to have an injection in their buttocks every day for 6 months or more. So it was really hard, and the outcomes were not good. So a lot of patients didn't finish their treatment, and a lot of patients died, or treatment just didn't work for those patients.
I've always been aware of TB, especially living in the Western Cape. So you find that we hear that there's most infections here, and TB is a virus that can be transmitted. And then you see adverts about all of the different ways that one can catch it. So it's easy for people to misunderstand and be afraid. So it was a little bit of a challenge to try and figure out and try to explain as well to other family members that might not have the same knowledge and understanding of what TB is and the type that she had.
I thought I was going to die. I thought like it was the end of my life, because I was so weak, and I lost so much weight. And then before I got diagnosed with TB, I used to hear stories about people dying from TB, and especially from the rural areas where I come from, where I used to live before. So I knew that I'm going to die. There's no other way out. I'm going to die. There's nothing they can do. Especially when I was on the injection, I felt like giving up. I felt like, okay, I asked my sister, please, can I just not go to the clinic? Maybe this virus will just end my life and stuff. And then she said, no, you cannot do that, because there's still hope. 2 years is not a long period.
We didn't isolate her. We were sitting together, watching TV, we were eating dinner together. So we were trying to keep things as normal as we could in our household. So information would be very important to the person or the family that's supporting someone who's infected. But both in terms of educating the person who has TB and the family that's going to look after that person. I feel like there's a little bit of a gap where government is not covering they'll educate the person, but they won't bring the family along on that journey. So if you want to find out information, then you have to kind of insert yourself, go to the clinic, talk to the nurse, talk to the doctor, what's happening now, what's next. So I had to go in and kind of ask those questions myself with every visit. Instead of letting her go on her own, I would be in there and asking the questions that I needed to kind of feedback to the little ones that are needing to understand. So how do we prevent ourselves from getting TB? Because we've never had in our family, and we don't know how she got infected. So there was like so many questions. It was winter, it was spring, it was summer. When is the infections most prevalent? So that information is information that most of us don't have. We have the surface, we see what government communicates on TV or these leaflets, but it's not enough for one to stand and support someone who's going through this journey with confidence.
We started a program to provide care for drug-resistant TB that was in the community. Instead of sending patients all the way into a specialist TB hospital and taking them away from their families for months and months at a time, we decided it was much better to treat them at home, if possible, if they were well enough not to go into hospital. And this means that more patients can get treatment, and they can get treatment much quicker. So that's what we showed with some of our research. And of course, if you give patients treatment much quicker, it'll reduce the risk of transmission to other people, particularly in the family. So that's really important. And we've also done research on some of the new diagnostics that have been introduced to try and tackle drug-resistant TB. So we looked at what we call the expert test, which diagnoses both TB and resistance to the most important TB drug, rifampicin, at the same time. And if we have this test, it means that we can actually test everyone who has TB right from the start and get them onto the right treatment regimen as quickly as possible, which is good for both the individual, so that it means that they can get treatment much quicker, and for the population in terms of reducing transmission.
I went to school. I told my friends that I had a lung problem. That's the only thing that I told them. And then because I was afraid that they might also catch the virus and get sick as well, so I asked the nurses at my clinic to go to my class and do a TB test for everyone without revealing my name that I have MDR TB. So they interviewed all of us, including me. Yeah, so yeah, I didn't tell them about the MDR TB because at that time I was afraid they would distance themselves or they would gossip about me. And then I only told them when I was discharged from the treatment.
The National Department of Health has been very innovative and forward-thinking. So here access is probably not so much of a problem. But because they're new drugs and they're relatively expensive, in some other countries they're still not available to many of the patients that need them, which is a real problem. So I guess it's a matter of pushing for more money globally to just fund access to these drugs. But certainly within South Africa, access has improved quite a lot. And that's part of also decentralising care as well, so that you don't just provide treatment in specialist hospitals in the big cities like Durban and Cape Town and Johannesburg. You can actually provide this treatment at clinics and more district hospitals, so it's much more accessible to patients with TB.
My life now is fine, although I haven't done everything. I haven't reached all my goals, but it's getting there. I have a baby and I have a healthy baby. I have a healthy big baby. I even forgot that I once had TB.
We still need even better diagnostics that can tell us not just resistance to one drug, but resistance to all of the drugs that we currently use. At the moment, we don't have that routinely. So that would be an area for further research. And of course, we're always going to need new drugs because resistance will always develop. So into the future, we really need a pipeline of new drugs and new diagnostics coming through from research all the way through to being used in the field. And I think ultimately we just need much more attention globally on this problem so that we can get more political will and more funding, both for research but also to provide treatment. Otherwise, if we don't sort of tackle the problem, then this transmission will just continue and more people will get drug-resistant TB, which is certainly not what we want.